Hello and welcome to Interstitial Cystitis India. Today we have a very special guest, Dr. Sarita Nayak from Mumbai. Dr. Sarita is a consultant urogynecologist. She's a specialist in female urinary incontinence and female sexual dysfunction. She's also a diploma holder in psychosexual medicines and integrated counseling techniques. So today we will be discussing with Dr. Sarita. So the first question to you, Dr. Sarita, is that we all know that the third wave of COVID is sweeping our country, and many of our patients are also suffering from COVID. And as you know that we are suffering from a chronic condition, and COVID on top of it is making our conditions even worse. So my first question to you is, as an IC patient, how should we deal with the lethargy that is coming with COVID? Because we are generally, we suffer from fatigue and a little bit of lethargy. So COVID is making it worse. So how do we deal with it?
Thank you, Balika, first of all, having me here and, giving this platform to me where we can discuss a lot about interstitial cystitis and especially in the COVID era, means this COVID phase. Rightly, you have said this, that with COVID, this third wave now, somewhere, our patients of IC, interstitial cystitis, they are suffering more because a baseline disorder which has chronic inflammation going on in the body. On top of that, COVID infection, which is known to give you varied symptoms, especially this third wave, we are seeing a lot of atypical symptoms. Though we know that this particular viral strain is not serious, but yes, the atypical cases are on a high. Unusual symptoms which are pertaining to vasculitis, extensive myalgias, muscle pains, fatigue, and somehow the interstitial cystitis complex, because I think I've started adding this word to IC as IC complex rather than just interstitial cystitis, because there are so many of our patients who have baseline fibromyalgias, they are pelvic floor muscle spasms. Overall, there has been sensitization of the nervous system. So they are already so prone for so much of pain mediators surging up in the body. And on top of that, when COVID myalgias add on to it, the situation becomes really bad, really, really bad. So I have been getting a lot of messages from our IC patients, and the way the body is giving up, the bladder symptoms getting flared up in this way, and it's terrible. It's quite significantly there. Now, your question that how do they cope up? Uh, First thing is give time. It's a viral infection. Definitely, it has become one of the precipitating flares. It has become a trigger point of flares in our IC cases. Sudden surge of urine symptoms can happen. On top of that, the pain substances and mediators are on a high in the system. So myalgias may be prolonged. Fatigue may be more prolonged because if the patient is already in a central or peripheral sensitization mode, the release of the pain substances will be much more than any other patient who is dealing with COVID. So, giving time is important, hydrating yourself is important, listening to your body. Don't just jump out of bed and think that, okay, I'm done with COVID, quarantine is over, I'll be back to my work. Listen to yourself, give time, take regular breaks. For urine symptoms, if they flare up, stay connected with the primary doctor who you are with. It may be challenging, and we are seeing these challenges.
Uh, Second question that I wanted to ask is that for COVID, doctors are prescribing multivitamins, but most of IC patients are not able to take multivitamins, especially vitamin C that really flares us up. So, what is the solution for this? Because we also need those
Yeah.
vitamins.
Yeah, I agree. And the thing is, that's the trickiest zone. Just like I said, that whatever is applicable to a regular person may not be applicable to IC patients, and not just IC, all patients who have autoimmune disorders, who have inflammatory pains, IBS, interstitial cystitis is just one of that spectrum. So all those patients whose body doesn't respond to extremes of pH of the medications or whatever you ingest, like vitamin C is just citric acid. So if somebody takes that high doses of vitamin C as being prescribed rampantly in COVID times, we have seen it for last 2 years. People are medicating themselves with high doses of zinc-ovate, vitamin C, and then those, excessive kadas with lemon water, with all kind of herbs and things like that, green teas, all kind of spices added to it. Now, for IC patients, that's one of the most tricky zones. How do we do that? The slight shift in the pH of urine from neutral to anything which goes more acidic or more alkaline, both can trigger flares. And that's where the challenge lies. If I start putting vitamin C every day into IC patient, it will just make urine more acidic and the patient may get miserable with the pain triggers. While if I alkalinize it more, start giving Citra Alka, Citra Soda, again, very simply, these medicines are prescribed thinking about UTI to any patient in India. It can flare up because even the alkaline excessive pH in urine can cause severe flares in the bladder mucosa. So the answer is to strike the right balance. Start with small doses because yes, we know that we need vitamin C for the integrity of the mucosa, the collagen, in general immunity, but we can't overdo that. And every patient is different. Every single patient will have different flares, different sensitivities, and everybody has different tolerance to different doses. So what I try in my practice, I try to customize and empower my patient, educate my patient to listen to their own science. Start with smallest possible doses, make it alternate days first or weekly first, upgrade it or downgrade it. If somebody is already on daily vitamin C and is not able to figure out that whether the symptoms of flare are getting worse with this, shall I stop or not stop? Then we try to make it alternate days or make twice a week first or make it once a week first, slowly either increase or decrease. So a lot of permutation combination is needed there. A lot of connection and interaction between the doctor and the patient is needed. So important is that availability of the physician, the doctor to the patient, the awareness of patient to chart the symptoms, score them. Because I have got very hardworking patients with me who literally writes down one single day score of their pain, their urgency, what triggers it, what doesn't, and the kind of supplements they are taking, and then it helps me to adjust depending on individual sensitivity. The rampant use of just blindly taking zinc, zinc-ovate, vitamin C may have flared a lot of people without knowing. So that's the area of caution we need to excise.
Absolutely. I agree with you that um, many
Yeah.
patients have flared because of excessive taking of all these medicines. So, would you suggest that an IC patient, if she or he gets COVID, should they go to a general physician or should they come to the urologist? Because a urologist will have
Yeah.
they know their condition, because often the general practitioner, they go by a very generic prescription, so that may not be helpful for us.
Yeah. See, it's IC is one condition, and like any other chronic inflammatory condition, just like diabetes, hypertension, they have become lifestyle issues and they are chronic issues. How you prefer to go to a doctor who knows in and out everything about you? I say a similar condition. It is always good to stay connected to a team of doctors who know your case, be it a urologist, be it a gynecologist, be it a urogynec, be it your physician, be it your pain management team, be it your pelvic floor rehab practitioner, your PT. It has to be managed by a team because not one person knows it all. always I highlight that fact. This condition, one person cannot know it all and one person cannot manage it all. You will need more helping hands at different points of time. And even one particular doctor or your care provider may not be available all the time. And we know, you know, every single patient of IC knows that a flare can happen in fraction of seconds. It's like at 8 o'clock patient was okay and 8:15 the patient can be in miserable pain. Now, you, not everybody will be accessible, and what do you do? And then going to any general person who doesn't know about this, I won't blame our doctors because awareness of IC has picked up only in last 5 or 10 years or so. Not all practitioners really know about it. I won't really say that it's their fault. It's just that the condition is finding its definitions now. So we need to even educate doctors, we need to even create awareness among patients so that they know whom to approach. This is the panel of doctors, like I said, a gynec who knows about it, a urologist who has been dealing with it, a urogynec whose forte is this, a pelvic floor therapist, even a psychiatrist and a pain management team. So there will be a 6 or 7, you know, your support system will have these 6 7 specialists whom you should be able to approach at drop of a pen also. कि मुझे आज ये हो रहा है, मैं किसके पास जाऊं, ये अवेलेबल नहीं है, ये है, ये नहीं है तो ये है. Because these all have to be connected. All of them, they should be knowing each and every detail of this one person so that the person don't feel lost. Going to a random physician will again write Cital, again put you on some medicines which you know that they won't work. Antibiotic, thinking it's UTI, and you know. And then you come back frustrated, disappointed, that, you know, they don't know. They don't know. Pardon them, they don't know, but go to the people who know. So keep your team ready so that you don't sink in those moments of pain and despair कि कोई नहीं है मेरे पास. Don't be there.
You mentioned about psychiatrist, and following that, my next question is that, you know, with COVID and this last 2 years of pandemic, the stress level has increased not only among IC patients, I think among the general populace. So this is also contributing to IC flare-ups. And so in this COVID situation, do you think that IC patients should, because I know most patients, they don't really have a psychotherapist or a counselor in their team. So do you think it is okay now to go to for somebody for mental health support? Because, you know, there's this taboo and many don't really feel like going. But how to manage stress?
See, the thing is, I see that, you know, लोगों को बीमारियां होती हैं, लोगों के एक्सीडेंट्स होते हैं, चलो कोविड ही हो रहा है, किसी को दिख रहा है कि कोविड है, सांस नहीं आ रहा है, SpO2 फॉल हो रहा है, घर के किसी मेंबर को ही हुआ है, चलिए. These are visible things which have objectivity to it, and people give so much allowance for that. You know कि इसको ये हुआ है, इसको ये. IC is one condition. There is no way you can objectify what a patient goes through. Already there has been so much labels on them कि सब दिमाग में है. It's all in your head. सबको होता है, इतना तुमको क्या हो रहा है. And there are people who have been rejected by multiple medical practitioners just because they were not able to identify. I again don't blame anyone, but still the patients go through a lot. Now let us say if the patient of IC who on a daily basis is just learning to cope up, finding her path or his path throughout, still figuring out, and now there is a member in the family who is COVID positive. Now this particular lady who's running in and out, trying to manage everything, manage a child also, a senior citizen also, still maintaining that distancing so that if she catches it, she will be further miserable. Now this is enormous stress. This is tremendous stress. We as normal people, apparently normal, whatever we say to ourselves, when we get COVID in our families, we undergo through so much. Imagine a person who is dealing with IC, dealing with their own body issues, mind issues, what kind of stress it can be on them. It just throws them up and down. Now, the important part is you have to have a counselor or a therapist. Now, it's like in modern world we have labeled, you know, these psychotherapists, counselors. There are professional helps available, but is it really possible for every single patient of IC to afford one counselor, round the clock available? Is it possible? No, because there is a lot of time involved, a lot of fees involved, and IC patients are drained financially because of vast kind of medications, consultations, and all. Now, if I ask that, yes, it is must, there has to be a counselor all the time whenever in the team. Yes, if possible, I wish there was that support system in India where there could have been allotted a mandatory counselor to every patient of IC, because we know psychological stress affects pelvic floor spasms and it affects pelvic floor function badly. But now what to do? So it's important to have that sets of friends, a set of a support system. Like what you are doing is great. IC India is great. So this forum, those blogs, those platforms where people are available to each other, patients supporting patients, women supporting women, and that's what I always call W for W, women for women. Means if they know what is this pain, so there is a support system somewhere who understands what you are going through, and that I think is quite important. That someone somewhere knows what you are going through, and that kind of a leverage, a support, that okay, किसी को तो पता है मेरे साथ क्या हो रहा है, that helps. So counselor may not be available, but the set of people have to be there around you who knows it, who can listen to you, though may not be able to find fixed solutions, and at times they do, because किसी ने कुछ try किया था और उससे उसको help हुआ था COVID phase में, या उसने अपने घर में ऐसे manage किया. That kind of information through these groups helps. And then being as a doctor a part of that group of your platform, at least I can observe, can monitor कि कोई wrong information नहीं exchange हो रही है, which might not be true, in terms of medicines and all. So the kind of work you are doing is actually making a support system as a counselor available all the time, right? Yes, those who can have a therapist continuously, that will be great bonus. It should be there.
Yes, thank you, doctor, for this appreciation. Now the thing is inflammation. How long do you think it will take for a IC patient to heal from the inflammation that is caused post-COVID? Because I believe our bodies are already inflamed and
Yeah.
COVID is further inflaming it. So when can we expect to get little better after this?
See, normal people, means apparently healthy normal people, are still taking so much time, after 3 months also, 6 months also. I meet our doctor colleagues, they say that there has been tremendous fall in stamina. They're not able to sort of go back to their gyms, cycling, this, that. So they do feel that there is certain level of drop in their stamina, and the way they were exercising before and doing all their things, a lot of mental toll has been happened. So they've taken a little bit of backstage and they're going slow. For IC, I think it will be much more. So there are patients who are up and about in 2 weeks of getting COVID negative report in their hand. There are people who is like finishing 1 year now and they still tell me that I still don't feel optimum, the best of my health still. Well, it all depends that in the beginning, what was your general health condition, which is anyhow compromised in IC patients because of the whole entire mental and physical drain which they are already in. So it takes much more longer. How much? We don't know yet. We are still in that phase where we are seeing cases who are healing from COVID. You yourself know it. You know you are going through it, and you know how you still feel at times challenged. So we are learning the process that कितना time लगेगा वापस हमारे IC patients को to catch back the life, and for them it's a lifelong process, right?
Yes, yes, that is true. That it is going to take some time because most patients, what has happened is that post COVID, they have also their IC symptoms have also flared up. So now they have more urgency, more frequency,
True.
weakness, and you can imagine if you're feeling weak, you don't feel like leaving the bed, but you have to go to the urine to pass urine every 10
True.
15 minutes. That is, I think, making their conditions worse, and then they are not able to take vitamins. They are taking vitamins that is flaring them. So it is going to be really challenging. I think next 1.5 years at least, we will have to look for symptoms,
Definitely.
whatever
Yeah.
is taking. So now I think we can move on to other questions, because this was more or less the questions that I had from patients regarding COVID. So
Yeah.
yeah, now we can move on to other questions.